Okay.
So the extension synergy is usually for the lower extremity. So they're going to be in like external rotation, plantar flexion, and like a little bit abducted, a little bit like this. So what she was saying, what you could do is you can do some weight bearing. So you can bend them a little bit and weight bear them a little, because weight bearing helps to facilitate and to inhibit. So you can put a little bit of pressure here, put a little bit of pressure there.
What does
right?
there mean? Like,
Weight bear is to put pressure on the actual joint. So right now I'm putting
Pushing from the
pressure
inside.
on the ankle joint and the knee joint. You can weight bear like this, right? Or let's say she's stuck like this, right? She's saying whatever position they're in, you want to get them out of that position and do the opposite. So if she's like this, you want to take her. And do a prolonged stretch, because a prolonged stretch is an inhibitory technique. But if she's like this, you want to maybe bend her. I'm bringing it into dorsiflexion and I'm bending her knee and I'm trying to bring it into more flexion. I'm doing a prolonged stretch inhibitory technique to relax the extensor synergy of the lower extremity. Okay, so that's what she taught us so far. Don't cut it out.
Okay. So sometimes a patient, we ask them to do weight bearing, and sometimes they can hold it here independently. Then we just hold, and then we just, our hand placement gonna be like this, and then we put pressure on the hip like this. But if he slide like this, the patient cannot hold, then we, no, just relax. So PT want to use the knee to stabilize this, and then from this direction, and then we like this. I'm too short, but technically you should be higher, and then one hand on the hip, and one hand on the knee. That one called what?
That's called
approximation.
And that's to facilitate.
Facility.
Or like, oh, push down, or like just hold it there, and then weight bearing on the joint, and that could be facilitatory too, or inhibitory. Yeah.